Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and we are just going to execute a very simple role play that is for the speaking. Again, for the new students and for our recent followers on YouTube, you will get 3 minutes to prepare the speaking topic. So again, I will do it again for you. So you will have 3 minutes to prepare the topic. That means you can write anything. आप यहाँ पे कुछ भी लिख सकते हो. And then you have to speak the role play for 5 minutes. So 3 minutes to prepare and 5 minutes to speak. So what do you do in these 3 minutes that I'm going to tell you? So first of all, what you can do, you can understand the situation that you are paying a home visit. So obviously when you are paying a home visit, so you will say good morning. My name is this. I am a nurse. Simple. And I have come here to जो वहां पे दिया है. Left schedule spouse called the hospital today. His last evening the spouse is concerned about him or her knee. Why the patient is refusing, has asked you to visit the patient at there. During the home visit you notice that patient is so. I have come here to see your progress after the knee replacement. Total knee replacement. So that is always, I'm telling you everyone, no matter how good you are in speaking, always write this thing. The first line is the most difficult line. फर्स्ट लाइन में गड़बड़ होने के चांस बहुत ज्यादा होते हैं, तो इस लाइन को पूरा लिखना है. आप चाहे कितने ही इंटेलिजेंट हो, आपको ये लाइन लिखनी है हमेशा. फिर आपको सिचुएशन बतानी है, फिर आपको पूछना है. तो आप पेशेंट के घर गए हो जिसने टोटल नी रिप्लेसमेंट करवाई थी 3 हफ्ते पहले, 3 weeks ago. At the time of the discharge, the patient was advised to use walker for activities of daily living and ensure compliance with physical therapy at home. यानी जो exercises की थी वो करनी है, बताई थी. And follow up appointment scheduled next month. यानी 1 हफ्ते के बाद अपॉइंटमेंट है, क्योंकि 3 हफ्ते तो हो ही गए हैं. तो 1 month के बाद अपॉइंटमेंट है, यानी अब 1 week रह गया, क्योंकि 3 हफ्ते पूरे हो गए हैं और उसकी अपॉइंटमेंट थी नेक्स्ट मंथ की. सो यानी 4 weeks बाद की. तो टोटल अब उसका 1 हफ्ता रह गया अपॉइंटमेंट को. तो हुआ क्या है, व्हाट इज द सिचुएशन. आपको हमेशा सिचुएशन समझनी है. हर स्पाउस कॉल्ड द हॉस्पिटल टुडे एंड एक्सप्लेन दैट ही शी इज नॉट यूजिंग हिज वॉकर सिंस लास्ट इवनिंग. तो जो 4 हफ्ते के बाद उसका रिव्यू विजिट था, उसमें डॉक्टर देख के बताता, ऑर्थोपेडिशियन देख के बताता कि आपको वॉकर यूज करना है या नहीं करना. बट दैट पर्सन हैज ऑलरेडी स्टॉप्ड यूजिंग द वॉकर सिंस लास्ट इवनिंग. यानी जो काम 4 हफ्ते के बाद रिव्यू के बाद होना था, वो पेशेंट ने 3 हफ्ते में ही छोड़ दिया. सो दैट इज व्हाट इज द कंसर्न, दैट पेशेंट इज नॉट यूजिंग द वॉकर. Spouse is concerned about him her hurting his knee and has asked you to visit the patient at their house. तो हस्बैंड को अगर ये सर्जरी हुआ है तो वाइफ ने घर पे बुलाया. एक चीज को इमेजिन कर लो पहले. During your visit today, you also notice that patient is not using a walker to walk around the house. तो जब आप वहां पे पहुंचते हो, when the nurse यानी कि you reach at his home and you see him, you see that he is not using the walker to walk around the house. So आपको भी ये देख के अजीब लगता है कि डॉक्टर ने 4 week के लिए वॉकर बोला है और उसकी वाइफ भी सच बोल रही है. फाइंड आउट व्हाई द पेशेंट इज रिफ्यूजिंग टू वॉकर. सो अगेन हमेशा लिख दो, कुड यू प्लीज टेल मी. ये लाइन तो आपको हमेशा आनी चाहिए, जो नए स्टूडेंट है एंड अवर न्यू यूट्यूब फॉलोअर्स, हमेशा इस लाइन को जरूर समझो. कुड यू प्लीज टेल मी व्हाई आर यू नॉट यूजिंग द वॉकर. तो इस लाइन को पहले लिख दो. क्वेश्चन मार्क वाली लाइन को हमेशा पहले ही लिख दो. क्वेश्चन मार्क्स बनाने मुश्किल होते हैं, उस लाइन को हमेशा लिख देना चाहिए, और जो मैंने ऊपर लाइन लिखी है उनको भी पहले ही लिख देना चाहिए. Educate the patient on the importance of using a walker for his recovery. That walker is very helpful to assist in the balance. It helps to put less weight on the operated knee due to weakened muscles. There are high chances of injury. So please understand. You may feel, आपको लग सकता है, you may feel that your knee is well, but it is still vulnerable due to weakened muscles. Vulnerable है, गड़बड़ हो सकती है अगर आप ज्यादा वेट डालोगे, तो आपको वॉकर यूज करना चाहिए. Persuade the patient to use a walker until his follow-up appointment. तो आपकी follow-up appointment next week है, क्योंकि 1 हफ्ते बाद, 1 महीने बाद की थी, 3 हफ्ते तो हो ही गए हैं. सो प्लीज अंडरस्टैंड, सिर्फ एक हफ्ता और यूज करना है आपको, एंड आफ्टर दैट यू कैन डू। सो यहाँ पे लिख दो 1 more week। तो जो आसान चीजें हैं उसको लिख दो 1 more week। सो इट इज जस्ट अ मैटर ऑफ 1 more week। चाहे इस लाइन को पूरा लिख दो ताकि आपको कंफ्यूजन ना हो, क्योंकि इतना टाइम है आपके पास, 3 मिनट्स क्या करेंगे, लिख दो सब कुछ। इट इज जस्ट मैटर ऑफ 1 more week। एक्सप्लेन द रिस्क इन्वॉल्व, अगर आप नहीं करोगे तो आपका रिकवरी टाइम बढ़ जाएगा, रिकवरी टाइम बढ़ जाएगा, और इवन फेलियर भी हो सकता है नी रिप्लेसमेंट का, एंड दिस कैन लीड टू मैनी कॉम्प्लिकेशंस। सो प्लीज अंडरस्टैंड, यू नीड टू फॉलो डॉक्टर्स इंस्ट्रक्शन, नीड टू फॉलो डॉक्टर्स एडवाइस। देखिए अब पूरा टॉपिक आपके सामने तैयार हो गया, और प्लीज everybody, I have told you, whether you are YouTube listener or whether you are student of Dr. BKM Institutes, please understand that it is very important to practice with me। जब मैं प्रैक्टिस कर रहा हूं तो आपको भी जरूर प्रैक्टिस करना है, so it is very important। So I'm just going to do that for you। Good morning, my name is Bhupesh and I am a nurse। I have come here to see your progress after your knee replacement। So how are you feeling today? Well, nurse, I am feeling all right। Okay, that is good to know that you are feeling all right. But what I can notice is that you are not using a walker to walk around your house। So could you please tell me, why are you not using the walker? Well, nurse, I feel much better. And you know, whenever I use the walker, I feel that I am very old। So please understand, I am just 64-year-old, but when I use the walker, it appears I am 84. So I feel embarrassed। See, please understand, it is not a matter of embarrassment or pride। Please understand, it is a medical treatment। You have undergone total knee replacement, and it takes around 4 weeks for the complete healing of knee। So doctor has advised you to come for a follow-up appointment, which is scheduled next week, as 3 weeks have already gone। So please understand, it's just matter of 1 more week, and you need to use the Willy Walker। But nurse, why aren't you understanding? I'm not comfortable with the Willy Walker। You know, I used it for 3 weeks. Since yesterday, I am feeling better, and I have tried to walk around my home, and I am very comfortable। See, that happens with every patient। Every patient feels that, you know, that they do not require walker after 3 weeks. But to be very honest, walker is very helpful। First of all, it will speed up your recovery। That is why after 3 weeks you are feeling better, just because of the walker। If you will not use the walker, after some time your knee will start aching again, this will have pain, it can become sore, and also you can go through various complications, it that might disturb your balance. And also, operated knee is very weak due to the weakened muscles, so it can lead to many complications and failure of knee replacement surgery, and even the recovery time can increase। So please understand, you need to follow the instructions। Talking about the importance of a walker, I would like to tell you that walker is very helpful to help with the balance, and it helps to put less weight on your operated knee due to the weakened muscles। So it is very important for you to use this walker to have your knees recovered quickly। But nurse, I don't know, it's just I feel too bad। See, it is just matter of 1 more week, I've already told you। After that you can stop using the walker after a doctor's instructions, but at this moment, if you will not use the walker, this might increase the span of walker usage, because if your knee would be hurt, or if you go through a knee replacement surgery, and if the failure happens, then you might have to use it even for a long time, and it is not easy to operate again, so it can lead to permanent failure as well। So please understand, I am not trying to scare you, but I am telling you the fact that after knee replacement, it is very important to use the walker। Okay, nurse, I will try and use that। Well, that is great that you have agreed to my request, and it is really important to follow the doctor's instruction। In the end, I would like to reassure you that your operation, हमेशा reassure जरूर करना है। In the end, I would like to reassure you that it is that you will feel better after 1 week. You will feel even stronger with your knee after 1 week. So please follow the instructions given by the doctor, and if you will follow these instructions, your recovery would be faster. So please make sure that you will use the walker for this week. Is that okay? Yes, nurse, that's okay. Okay, that's great. And now I am leaving. Here is the leaflet which I am providing you again, talking about the benefits of using the walker. Like it will help to improve the balance, and also it will help to put less weight on your operated knee, which is having weakened muscles. So this leaflet will help you to understand the situation again. Still, if there is any doubt, please feel free to contact us. आपको रोल प्ले ऐसे बोलना होता है, और ये स्पाउस की बात कभी नहीं करना, नहीं तो उसको लगेगा उसके स्पाउस ने कंप्लेन किया। तो ऐसे मत बोलो कि आपके स्पाउस ने कहा है, और जैसे आप कहोगे आपके स्पाउस ने हॉस्पिटल में कॉल किया, तो आपका रोल प्ले भी कॉम्प्लेक्स हो जाएगा। सो यू कैन अवॉइड दिस थिंग, एंड ऑल्सो यू कैन रिपीट। जब आपका रोल प्ले छोटा है, 5 मिनट्स कवर नहीं हो रहे, तो आप उसको रीएश्योर में रिपीट कर सकते हो। आई रीएश्योर यू दैट यू विल बी फाइन विद इन अ वीक, and also you have your appointment next week, so doctor will see you and maybe he will tell you to stop the walker. But as you are recovering in a very nice way, so do not take any risk. It can lead to various kind of complication, so that you will have to speak for 5 minutes. Again, you need to listen to this speaking at least 3-4 times, so that you can speak what is right, and it is very important. If you will not listen to it 3-4 times, then you will not be able to reach at the level which we desire. And also you should write side by side. कभी कभार अगर आप नए स्टूडेंट्स हो, आपको साथ साथ लिखना भी चाहिए। 3-4 बार सुनो, अपने हाथ से लिखो पूरा का पूरा रोल प्ले, देन यू विल लर्न मोर। उसको 3-4 बार पढ़ो, सो यू विल लर्न द ग्रामर, एंड ऑल्सो यू वुड लर्न गुड थिंग्स अबाउट इट। सो दिस इज डॉक्टर भूपेश फ्रॉम डॉक्टर बीकेएम इंस्टीट्यूट्स। नाउ आई विल टेक डाउट्स ऑफ व्यूअर्स, अगर आपको इस रोल प्ले में कोई भी डाउट है, बट आई एम स्टॉपिंग द रिकॉर्डिंग एट द मोमेंट। Take care.